Good morning, everyone. Myself, Dr. Ekta Kangale, Junior Resident, IGGMC Nagpur. Today, I am going to present a topic on study of acceptance, safety, and expulsion of post-placental intrauterine contraceptive device among postpartum mothers in tertiary care institute. Uh, so, what is PPIUCD? PPIUCD is postpartum intrauterine contraceptive device inserted in women, ideally within 10 minutes on post-placental delivery and up to 48 hours after birth. Uh, Most commonly uses copper T 380A as it is highly effective, safe, long-acting, rapidly reversible, coitus independent, no interference with lactation, it doesn't interact with medications. Insertion during delivery, checkup and it requires minimal follow-up, early removal at patient's request. Uh, why PPIOCT is used? As it has additional benefits, non-interference with breastfeeding, easily available, free of cost as approved by Government of India, low failure rate and convenient for both women and their healthcare providers. Um, and associated with less discomfort, fewer side effects than interventions. It allows women to obtain safe, long-acting, highly effective contraception while already within the hospital facility. What are the aims and objectives? To determine the proportion of women accepting immediate PPIOCD insertion, safety and expulsion. To study the socio-demographic study profile of participants among study population to determine the rate of expulsion, infection, loss string, and displacement following insertion of PPIOCD among the acceptors by 6 weeks. Uh, uh, we have conducted prospective observational study from January 21 to 22. Total 93 cases were analyzed to detailed history, demographic character, period of counseling, reasons for acceptance, reasons for refusal, follow-up at 6 weeks, complication at 6 weeks, and reasons for removal, inclusion and exclusion criteria. Criteria, women in the age group of 18 to 45-year-old were taken, gestational age more than 37 weeks, delivery by vaginal or cesarean section, no history of hypertension, diabetes mellitus, and those who are willing to give the informed risk consent after counseling. Exclusion criteria includes those who are anemic, less than HB 8 gram per deciliter, uh, preterm, premature rupture of membranes more than 18 hours, fever during labor or delivery, symptoms of infection, manual removal of placenta, and postpartum hemorrhage, HIV and AIDS, women having extensive genital trauma. What are the limitations? The patient's timing of counseling, those at the time of admission and during early labor and prior to scheduled cesarean section. Poor follow-up care of immediate PPIUCD acceptor leading to loss to follow-up cases available for the study. Findings and discussions. Total 320 women were counseled, out of which 93 women accepted for PPIUCD, 227 declined, of which the patients who came for follow-up are 81 and lost to follow-up are 12 patients. The patients who present with complaints like discharge, lower abdominal pain and loss strings are 7 patients and with no complaints 74. Patients who wanted to remove the copper T are 13 and out of which after counseling 11 patient wish to retain the copper T and two have undergone removal after counseling done. And the expulsion, those who come with expulsion are a total of 3 patients. And in 78 patients, the copper T is in their place. Baseline demographic characteristics for the study are the women's the women's who accepted the PPIUCD are more who are undergone LSCS, more from the urban area, rural area, unemployed, And uh, reasons for accepting IUCD. Uh, uh, those no interference with breastfeeding, non-hormonal, and as it is safe method, so reasons for accepting. Uh, Participants who reasons for removal of PPIOCD. No specific. There is no specific reason for removal of PPIOCD. Uh, Family advice of removal, and third, pain in abdomen. Uh, Most of the patients are satisfied after 6 weeks of PPIUCD insertion, and reasons complications after 6 weeks of PPIUCD no most present with no complication. Most of the patients present with no complication, and 6% present with expulsion of PPIUCD, 4% with menstrual bleeding problems. Then results, acceptance rate of PPICD was more in women who are from the rural area, unemployed, more in cesarean section than vaginal deliveries. Main complications were pain in abdomen. Expulsion rate was 6%. More common reason for removal are others, and 80% are willing to retain property after counseling. Uh, Conclusion, acceptance of PPIOCT was high in present study. Awareness of PPIOCT among these women were very poor despite acceptance. Many women have never heard about PPIOCT. Acceptance rate was higher among women with primary and secondary education than no higher education. PPIOCT was safe, having no incidence of perforation, pelvic infection, few lost string, low rate of expulsion. Majority of the acceptors rely on their physician's advice of their doctors, and a significant number of women declined PPIOCT because of the partner's involvement. This reveals that importance of partner involvement during counseling and decision making is most important. Thank you.
Okay, so it's good that the acceptance rate was so high in your study. When did you start counseling the patients? Because you said counseling is very important. So when did you start counseling them?
Ma'am, I counsel them at first visit when they come to OPDs, and in when they come to our labor room in labor, uh, then we counsel them.
Only once you are counseling? You are
When
able
they,
to convince them by counseling only once?
no ma'am, we
How
have
many
to
times they
counsel so
require?
many times because uh,
Okay.
patients are not willing to.
Okay. Did you have any patient who requested for removal within 6 weeks of insertion?
Yes ma'am.
And what did you do? How many patients? And what did you do for them?
First, we look for whether she have any complaints because of that copper T. If there is bleeding, heavy menstrual bleeding, or other complaints, then we ask for reason for
Within
removal
6 weeks?
within 6 weeks.
Within 6 weeks of insertion. Did you have any patients who requested removal within 6 weeks of insertion?
Um, patient,
Um, what do you think is the most important reason why a rural woman would come and request or rather get counseled by you and accept PPIUCD? A rural patient accepting PPIUCD. One most important reason why a person would do that.
doctors had asked.
Thank you.
Thank you.